This is mandible. It is the unpaired bone of the skull. It is the strongest and the largest bone of the face. Okay, so it articulates with this bone articulates with the temporal bone and form a synovial temporomandibular joint, and this bone forms the lower jaw. So see the articulated skull. This is mandible, this one is mandible, and it is forming lower jaw. This area is temporal bone, and here the condyle of mandible articulate here with the temporal bone to form a synovial temporomandibular joint. So this bone is consist of two parts, a body part and a rami. Body is horseshoe shaped. Single body is present, and the rami is 2 in number, which is broad, oblong, and projects upward from the posterior end of the body. Now coming to the parts, so it has one external surface. This is external surface, one internal surface, one upper border, and one lower border. First come to the external surface. On external surface you will get at the symphysis menti a triangular bony projection which is known as mental protuberance, and near the base of this mental protuberance you get another two bony elevation. This is known as mental tubercle. And just below the socket for the incisor tooth there is a depression on either side of this mental protuberance. This you could appreciate here. This depression is present. This depression is known as incisive fossa, and this fossa gives attachment to mentalis muscle. And also a few slips of orbicularis oris muscle. So if you see lateral to this incisive fossa, if you see here, you could see one foramen is present here. This foramen is known as mental foramen, and it transmits the mental vessels and nerve. So this foramen is directed backward and laterally, and it is present lateral to incisive fossa, and what structure traverse through it, those are mental vessels and the nerve. So if you see just below this foramen, you could appreciate one line is extending from this mental tubercle up to the anterior border of ramus of this mandible. So this is oblique line. It extends from the mental tubercle, goes upward and backward up to the anterior border of ramus of the mandible. So along this line three muscle is attached. One is the muscles are in most anterior part depressor labii inferioris, and behind that will be the depressor anguli oris, and opposite the three molar tooth there is attachment of buccinator muscle along this oblique line. So this is the picture of external surface. You could see different feature here. Now come to the inner surface. This one was the outer surface, and this is the inner surface. So on the inner surface you could see one oblique line is present which extends from the symphysis menti up to the third molar tooth. Here also bilaterally this line is present, and this line is known as mylohyoid line, and along this line one muscle is attached that is known as mylohyoid muscle. Mylohyoid muscle is attached along the mylohyoid line, and this mylohyoid line divides the inner surface of the mandible into upper smooth sublingual fossa for the sublingual gland and the lower concave submandibular fossa for the superficial part of the submandibular gland. In the anterior part of the submandibular fossa, a loop of facial artery is present between the bone externally and the submandibular gland internally. So the facial artery first come here, it loops around the inner aspect of the mandible and then curl upward and goes in the face at the junction of the ramus and the body of the mandible. So here in this part at the junction of the ramus and the body of the mandible, three structures is related here: tortuous facial artery, facial vein and the marginal mandibular nerve. So before going to the face, the facial artery makes a loop in the anterior part of the submandibular fossa. So below this mylohyoid line, a mylohyoid groove is present which transmits the mylohyoid vessels and the nerve. On the posterior aspect of this mylohyoid line, there is attachment of the superior constrictor muscle of the pharynx. So this is the superior border. Here is the incisor tooth, socket for the incisor tooth, the premolar and the molar, and behind the third premolar tooth, which correspond to this area gives attachment to pterygomandibular raphe. Pterygomandibular raphe, which is a ligament formed due to the thickening of buccopharyngeal fossa, and it is attached on the mandible behind the third molar tooth. So the other end of the pterygomandibular raphe is attached to the pterygoid humulus of medial pterygoid plate. In between the posterior part of the mylohyoid line and the third molar tooth, lingual nerve is related here. Before it goes to the tongue, the nerve is present in between the third molar tooth and the posterior end of mylohyoid line. Now see, at the posterior aspect of the symphysis menti, you could see on the inner surface one tubercle like thing is present. It is a paired structure. Just see here, this one, yes, this one. This is the superior genital tubercle, and similarly another inferior genital tubercle is also present, which is not present in this bone. Maybe it has been broken. So two genital tubercle is present here. So the superior genital tubercle, it gives attachment to genioglossus muscle, while the inferior, which should present here, it gives attachment to geniohyoid muscle. So two genital tubercle are present, superior genital tubercle and the inferior genital tubercle. Superior one gives attachment to genioglossus, while the inferior one gives attachment to geniohyoid muscle. Okay. Now come to the upper border. Upper border is also known as the alveolar border. This is the upper border. See, this one is the alveolar border of the bone. So upper border is also known as alveolar border, and it contains socket for the tooth. So in each half of the mandible, the dental formula is 2, 1, 2, 3. That is the 2 incisor tooth, 1 canine, 2 premolar and 3 molar tooth. So the dental formula is 2, 1, 2, 3, and the upper border contains the socket of the tooth for the lower jaw. Now come to the lower border. So this one was the upper border, and this is the lower border. Lower border extends backward and laterally, and on each side of the symphysis menti, on the lower border, there is presence of a depressed area. This is known as digastric fossa, which gives attachment to the digastric muscle. Rest of the lower border is continuous behind with the lower border of the ramus of the mandible. This portion is the ramus of the mandible up to this part. Behind this line, this part is the ramus of mandible. So In posterior aspect, the lower border of the mandible is continuous with the lower border of ramus of the ramus of the mandible. The entire lower border gives attachment to the platysma muscle. Apart from the platysma, there is attachment of investing layer of deep cervical fascia, which encloses the submandibular gland present in the submandibular fossa. So, the investing layer of deep cervical fascia splits into the superficial and the deep layer. Superficial layer is attached along the lower border, while the deep layer is attached along the mylohyoid line. Now come to the ramus of the mandible. The ramus of mandible is present on the posterior aspect of the body of the mandible. So it is a flat plate of the bone which extend vertically upward from the posterior aspect of the body of the mandible. So it has four borders: anterior border, posterior border, superior border or the mandibular notch, and the inferior border. And it has two surface, one external surface and one internal surface, and it has two process. One is the coronoid process anteriorly and the condylar process which forms the head of the mandible behind or in the posterior aspect. First come to the external surface or the lateral surface. So the external surface near the angle of mandible, around this area, it gives attachment to masseter muscle. If you see closely, fine ridge is present here on the external surface. This side also you could see a fine ridge is present, bony ridge is present here. These ridges for the intermuscular septa of the masseter muscle. So just above the attachment of masseter muscle on the lateral surface, this area come in relation with the parotid gland. Actually, parotid gland is related to the posterior border, and some part of it is related, come in contact with the external or the lateral surface of ramus of the mandible. Now come to the inner surface or the medial surface of the ramus of the mandible. So you could see one foramen is present here. This foramen is known as the mandibular foramen, and this foramen leads into a canal within the bone, and this is known as a mandibular canal, and it transmits the inferior alveolar vessels and the nerve. So this is the mandibular foramen, and this foramen leads to a canal which is known as a mandibular canal, and it transmits the inferior alveolar vessels and the nerve. So this mandibular foramen is guarded by a tongue-like projection of bone or bony spicule. You could see here it is projecting here in this side also, this projecting part, this is known as a lingula. It gives attachment to the sphenomandibular ligament. The area below the mandibular canal, this area gives attachment to medial pterygoid muscle, and this area is also marked by a oblique bony ridge for the intramuscular septa of the medial pterygoid muscle. Now come to the borders of the ramus of the mandible. So it has four borders. One is the anterior border, one is the posterior border which is thick and broad, one is the lower border which is continuous with the lower border of the body of the mandible, and one is the upper border. Upper border is also known as a mandibular notch, and it transmits the masseteric vessels and the nerve, and this upper border or mandibular notch is bounded in front by coronoid process and behind by the condylar process of the mandible. Anterior border is thin and sharp and is formed by the coronoid process. It gives attachment to temporalis muscle, and actually this coronoid process is formed due to the upward pull of the temporalis muscle. The posterior border is blunt, it is rounded and is related to the parotid gland, and the lower border is continuous with the base of the body of the mandible. Now come to this condylar process. Condylar process, it is expanded and it forms the articular head of the mandible. It is convex on all sides and is elliptical on the transverse aspect. So the axis of head, this is the axis of the head, is at the right angle to the ramus of the mandible. See, it is set at the right angle to the ramus of the mandible. So it is convex on all sides, but it is transversely elliptical. Okay. The head is covered by fibrocartilage and it articulates with the this mandibular fossa of the temporal bone and form separated by a articular disc and form a synovial temporomandibular joint. Okay. See, this is the mandible, and here is the mandibular fossa, and here is the head of the mandible, which is covered by articular cartilage on all sides, and it forms a synovial temporomandibular joint. Just below the head, this is the head, just below the head there is a constricted area present here. This is called the neck, and it gives attachment to the capsular ligament of the temporomandibular joint. So in the anteromedial aspect of the neck, this is the neck, this area, this depressed area is present, and it gives attachment to the lateral pterygoid muscle. So neck gives attachment to capsular ligament and lateral pterygoid muscle, and on the posterior aspect of the neck there is attachment of one ligament that is known as temporomandibular ligament, and also it is also related with a nerve. The medial surface of the neck, this medially, it is related with the auriculotemporal nerve. Now come to the angle of mandible. The bend you could see here is called the angle of mandible. It is present at the junction of the lower border and the posterior border, and it is around 110 to 115 degree in adult, but in newborn child it is around 140 degree. Now come to the ossification part. So mandible is the second bone to start ossification after the clavicle. So the ossification starts in the 6th week of intrauterine life from the fibrous envelope of Meckel's cartilage of first branchial arch. The two halves of the mandibular body are united by a fibrous joint at the symphysis menti, and it replaced by bone within second year of the life. In the around the angle of mandible there is attachment of stalomandibular ligament. So lastly, to summarize, mandible is a single bone of the skull. It has a body, it has two ramus, body is horseshoe shaped, ramus is flat and project upward, body has external surface. On external surface you will get mental protuberance, mental tubercle, mental foramen, one oblique line. It has a upper border which is known as the alveolar border, which gives attachment to the tooth. It has a lower border, body has a lower border which gives attachment to platysma. Behind the platysma there is attachment of investing layer of deep cervical fascia. Superficial layer is attached along the base, and the deep layer is attached along the mylohyoid line. Now come to the inner surface. Inner surface is divided by one oblique line which runs from the inner aspect of symphysis menti up to the third molar tooth. This line is known as mylohyoid line. It divides the inner surface into upper smooth sublingual fossa and lower concave submandibular fossa. Sublingual fossa, in the sublingual fossa lodges the sublingual gland, and in the submandibular fossa lodges the superficial part of submandibular gland. Opposite to the symphysis menti, two paired tubercle is present, one superior and one the inferior. Superior one is known as superior genital tubercle and inferior one is known as inferior genital tubercle, but in this bone inferior genital tubercle is not present. The superior one gives attachment to genioglossus while the inferior one gives attachment to genohyoid muscle. Along the mylohyoid line, mylohyoid muscle is attached. On inner aspect you will get one foramen. This is known as mandibular foramen. It is guided by the lingula, which is a bony projection, and it gives attachment to sphenomandibular ligament. This is the ramus. Ramus has one lateral surface, one medial surface and four border. One the posterior border which is related with the parotid gland, which is broad and smooth. One superior border which is known as mesenteric notch or mandibular notch, through which the mesenteric vessels and nerves passes, and one anterior border which is thin and sharp, and along this anterior border there is attachment of temporalis muscle. Two processes there, one is condylar process which is behind and one is coronoid process which is in front. Now what is the anatomical position? The anterior arched portion should face forward, the mental protuberance should be in anterior aspect, the alveolar socket should face upward. The condylar process should be on the posterior aspect, and the external surface will be the placed externally, and this one is the internal surface, and you hold it like this. This is the normal anatomical position of the mandible. Thank you.